Hi, I'm Mike, I'm a paramedic and I run training courses for London Hearts. Today we're going to show you how to use an AED. An AED, or automated external defibrillator, is a life-saving device that can deliver an electric shock when a heart has gone into an irregular rhythm due to cardiac arrest. An AED can be used on adults and on children over 1 year old, and using one in the crucial minutes after a cardiac arrest and before the arrival of the ambulance will significantly increase someone's chance of survival. Anyone can use an AED, even if you've never seen one before. You cannot cause any harm because the machine analyses the casualty's heart rhythm and then gives visual and voice prompts to guide you through the rescue process step by step. If a casualty is unresponsive and not breathing normally, ask someone to call 999 or 112 for emergency help, and ask them to fetch the nearest AED. The 999 operator will tell you where the nearest one is. If you're alone, make that emergency call yourself on your mobile phone, on speakerphone, and then start doing chest compressions. Due to the ongoing global pandemic, the advice from the UK Resuscitation Council is not to give rescue breaths, so start doing chest compressions only. The risk of actually contracting COVID whilst doing chest compressions is minimal, so don't be afraid to help someone who you suspect may be in cardiac arrest. Do not leave the casualty to look for an AED if you're alone, but keep doing chest compressions until someone brings it to you, or the emergency services arrive. As soon as an AED arrives, ask for it to be switched on while you continue with chest compressions. It will immediately start to give you a series of prompts telling you what you need to do at each step. If someone is with you, ask them to follow the instructions until the emergency services arrive. When the defib is switched on, it will advise you to call for help and to remove the clothing from the patient's chest to allow you to stick the pads directly onto their skin. You should try to do this without stopping the chest compressions. Place one pad on the right side under their collarbone and the other pad on the left side below the armpit. There may be visual instructions to show you the correct placement on the pad packaging. The AED will then begin to analyse the heart rhythm and determine if a shock is needed. Remember, the AED will only give a shock if it's necessary. The AED will alert you and everyone else around you to stand back so as the shock can be safely delivered to the patient. Once a shock has been given, the AED will advise you to resume chest compressions for 2 minutes until it analyses the heart rhythm again and determines if another shock is needed. Instead of giving a shock, the AED may say, "No shock advised, continue CPR." Just do what it tells you to do. If the casualty begins to show signs of life, leave them on their back with the AED attached and switched on. Continue to follow the voice and or visual prompts the device gives you until the ambulance arrives.
Call emergency medical services now. Adult mode. Follow the voice prompt calmly. Remove all clothing from chest and stomach. Rip clothing if necessary. Take out the pads from the bottom of the device. Tear open the pad's packaging. Look closely at the picture on each pad. Peel off the pad labelled 1 and stick to the bare skin of the patient, exactly as shown in the picture. Peel off the pad labelled 2 and stick to the bare skin of the patient, exactly as shown in the picture. Press the pads firmly to the bare skin of the patient. Do not touch the patient. Analysing heart rhythm. Shock advised. Stand clear. Press the flashing orange. Shock delivered. Begin CPR now. Press the flashing blue I button for CPR voice prompt. First.
So to recap, when using an AED, call 999 or 112 for emergency help. Continue giving chest compressions when the AED arrives and keep going whilst the pads are being applied. Ensure that the pads are stuck to the bare skin of the patient's chest. Ask for the AED to be switched on and then just follow the instructions it gives you. Ask other people to stand back and not to touch the patient whilst the AED is analysing the heart rhythm and when a shock is delivered. So there it is, that's how you use an AED. Just do what it tells you to do and you may save someone's life. If you found this video helpful, please consider supporting London Hearts by visiting their website londonhearts.org/donate. Thank you.